My name is Fernando Rothschild, VMC ER nurse for the past 21 years. It was approximately 6 months ago when I spoke before this esteemed body pertaining to the revolving door that our beloved hospital, Valley Medical Center, has become. It continues to be an excellent training ground for new nurses to hone their skills at a cost to the county of approximately $60,000 to $80,000 per nurse. Afterward, these well-trained nurses are recruited to other hospitals for higher paying entry-level nurse positions. O'Connor, Good Sam, El Camino just being a few of these. And now, at this pivotal moment in county history, on the verge of acquiring 2 more hospitals and DePaul Medical Center, they risk losing our most experienced nurses at these facilities with the threat of cutting their wages once they come under the umbrella of the county. You cannot continue to burn the candle at both ends without paying the price. Our patients and our nurses will suffer. Our communities will suffer. Today we come here before you as one with our union, RMPA, to ask for a living wage. Give us parity with these nurses from these hospitals you are acquiring. Give us an upgrade so that we can live and work in our communities. Help us help you maintain a safe, caring environment. Thank you.
Thank you.
My name is Melissa Truesdale. I have 19 plus years with Santa Clara County Valley Medical Center. Due to the unique circumstances at county, nursing has had to endure the unfortunate revolving door over the last few years. Our experienced nurses are tirelessly training new nurses in various specialties throughout the year, only to have those newly trained nurses leave within 1 to 2 years of hire, that they find other employment opportunities with better benefits and, more importantly, higher pay. This revolving door is detrimental to the patient care for multiple reasons. It perpetuates unsafe conditions on the floor as it forces the new nurses to be prematurely ushered into roles they are ill-equipped to handle. This significantly raises the risk to patient safety, as evidenced by medication errors, lack of resources during codes, and sentinel events. Our already hardworking nurses not only perform their daily duties, but are also left the additional burden of relentlessly training new hires, staying for overtime, or picking up extra shifts to cover short staffing. Nurses are even denied requests for time off due to perpetual staffing shortages.
And
workplace issues combined with
comment,
demands
please.
Of living.
Go ahead. Last comment. Then.
Okay. Demands with living in a county with an extremely high cost of living places additional strain on our nurses. Thank you.
The most effective way to retain these essential experienced nurses is through competitive compensation. As county nurses, we are among the hardest working in the nation, yet we are not compensated appropriately. If the county does not amend the current wage to one that is more competitive, there will be a mass exodus of indispensable experienced nurses from Valley Medical Center and the newly acquired facilities, further jeopardizing patient safety.
And thank you. Next speaker.
Good morning. My name is Elizabeth Killick, and I have worked in the intensive care nursery at Santa Clara Valley Medical Center for 19 years. This week, another experienced nurse is leaving to work at another hospital that is paying her $26 more per hour. There's a huge cost to replace an RN who leaves our unit, and when our unit is short-staffed, experienced nurses take the majority of the tasks done by others simply because they know how to care for the patients that new nurses do not. This is not safe for patients as the workload of experienced nurses increases, and this is not fair to the nurses who are getting burnt out. It's time to close the nurse staffing revolving door.
As an ICU nurse, I spend much of my time away from my family to care for all of yours. I do so with careful attention to my patient's safety. It has been disheartening to see that numerous dedicated nurses like myself have to leave because of financial necessity to find jobs with higher pay elsewhere. Given the opportunity, many of those would have stayed at county. The county needs to recognize that these dedicated nurses are truly valuable assets that need to be compensated and treasured. County nurses are among the hardest working in the nation, and they deserve to be paid accordingly.